Welcome to the very first episode of Ortho Out Loud, the official podcast of Fox Valley Orthopedics. I'm your host and teammate, Scott McKay, and in this podcast is all about exploring everyday activities, questions, and challenges through an orthopedic lens. In each episode, our physicians and special guests will share expert orthopedic advice, valuable insights, and real stories. For our first season, we're hitting the ground running, literally, and that will not be the last pun, by the way. We're diving into the world of running with a specific focus on training for a 5K. These races are everywhere, especially in the Fox Valley area, drawing in seasoned runners and first-timers alike. While 5Ks may seem approachable, proper training is key to preventing injuries and performing your best. That's where we come in. For this season, we'll be covering everything you need to know to train the right way, from injury prevention to race day strategy. So whether you're lacing up for the first time or looking to level up your performance, there is something here for you. Now, running puts a lot of stress on our feet and ankles, so understanding how to protect them is key. Today we're covering the most common foot and ankle injuries in runners, how to prevent them, and what to look for in the right pair of running shoes. To help me discuss this, I'm joined by Dr. Eric Bartel, a foot and ankle specialist and surgeon here at Fox Valley Orthopedics. Alongside him, a physician assistant who works very closely with him, Angie Lang. Dr. Bartel, can you take a moment to talk about your role and your legacy thus far at Fox Valley Orthopedics?
Thanks, Scott. Thanks for having me here.
Sure.
I've been here for about 28 years, and I've worked with foot and ankle problems during that time. We see a whole variety of people, including runners. That makes up a large component of our patients, and we see them for a variety of issues. And we try to help get them back onto their feet, and participating in activities that they enjoy doing is our best we can.
Now, Angie, is it true that you've been working with Dr. Bartel for nearly 2/3 of the time that he's been here?
That would be true. Yep, he got stuck with me, so poor guy. He's worked with me for about 18 years now.
What are some of the things you do with Dr. Bartel?
So I assist him both in the office as well as the operating room, so kind of a dual role. It's nice to work in a team. So I see patients independently, but if I ever need help, he's there for me to consult or go over x-rays with. And in the operating room, I fill the role as a first assist. So helping him do the surgeries, getting the patient's dressings on, suturing, that role.
Excellent. Thanks for your help for our patients here. Now let's get into today's topic. Let's start with the basics. What are the most common foot and ankle injuries you all see in runners?
That's a really tough one in that there can be a wide variety, but probably the overuse type of problems we see the most. And that can vary from things as common as plantar fasciitis, which is probably the most common thing, to any kind of tendonitis, Achilles, or some of the other tendons about the ankle and the foot. Foot pain to the ball of the foot, which would be considered metatarsalgia or bruising. We can have sprains to ligaments in the ball of the foot. We can have stress fractures, and those are just from kind of the ramp-up injuries that people have, let alone just an actual injury while training, such as an ankle sprain or something like that.
Sounds like a lot of things can go wrong.
A lot of things can go wrong. Not everybody gets them, but the potential is there.
How do these injuries usually occur?
A lot of these are just a lack of preparation. Some of it can be due to genetics, where people are a little bit predisposed to it, or it's a little easier for them to have this occur. But a lot of times we get so excited that we're going to jump into this sport, we're going to train for a 5K, and we go all out, and suddenly we overdo something, and now we find we're having problems, and that puts a kibosh on our dreams.
And that's terrible. We don't want to slow down. We want to keep moving.
Exactly.
Angie, what would you say are some of the early warning signs people should be looking for in order to seek help or hopefully prevent an injury from worsening?
I usually tell patients if they're really hurting the next morning, they probably overdid their training the day before, and they need to take a little recovery time. So I tell them to watch for things like swelling, pain, rubbing on their shoes. If they start noticing that their shoes are looking to be in poor shape or not fitting them well, and they're starting to get pain in kind of one spot all the time.
Okay. So I hear like shoes from both of you multiple times now. How are we supposed to find the right running shoe? Now, I've brought a few. Maybe you can help me figure out if I have the right running shoes or not. So if you don't mind, like, I was hoping to start maybe running with something like this, since currently it's a little colder out. Would this be a good way to start out?
Yeah, and Crocs. You need to run in Crocs.
Don't have Crocs, but when it does get warmer,
Those are
I
the
was
best.
thinking maybe
They
something
bring
like
us
this.
they bring us lots of patience. Running in Crocs, running in those shoes, like, you know, we're busy, but we can always make room for more.
This would be maybe a good one too, you think?
Yeah,
Yep.
totally.
Okay, that'll keep you in business.
They'll keep
Yep.
us in business.
Okay.
I will tell you, I have a friend who ran a lot of marathons, and he actually ran a marathon in a pair of sandals like that one time because he forgot his shoes, and he got away with it. And everybody else I run with looked at him like he was crazy, and I believe he was very, very lucky. So, yes.
So it turned out okay.
It turned out okay.
Okay, and maybe later on we'll go into some like different like low profile shoes and things like that that people are doing more nowadays, it seems.
Right.
If I want to be really, really fast, though, it seems like the fastest I can be is in these. So would it be okay to run with one of these? Like maybe if I had a little guard on the bottom, would that be appropriate?
Might find it a little tough unless you're
That
out
might
there
be a
on
little
the
difficult.
pond. Yes.
And I don't want to step on somebody else's foot with somebody like
Nope.
that. Okay. Well, what about if we had something more like this? Would this be a more appropriate, maybe a running shoe?
Yeah. I mean, that would be a classic example of your standard running shoe, which would be a trainer. There's lots of lingo, lots of varieties. There's the minimalistic, almost barefoot, all those kind of things. And if you're just getting into running, you probably don't want those. You want a standard running shoe. There's a lot of varieties. There's not a bad running shoe necessarily. There just may be running shoes that are not made for your foot shape.
So how would we determine that? How would,
If you're particularly newer to the field of running, you really want to get your foot sized and fitted by somebody who knows what they're doing. There are just a plethora of running shoes or running stores out there that can really help you with this. You can go in, you can have your shoe and foot sized. They will check to see the shape of your foot, whether you have a higher arch, a lower arch, and all the terminology that goes with that. But getting somebody knowledgeable on fitting shoes is a must to get started. And I also will tell you, one of the tricks is to go in later in the day because our feet all swell during the day, and so your shoe size will get a little bit bigger as the day goes by. So the best time to buy a shoe is probably in the late afternoon.
and so what else goes in with like foot shape? What are some of the important things? Is it how wide my foot is, how long my foot is, you know, whether my toenails are clipped enough that day, or what goes into all of that?
I think it's all of those things. You've got to look at, does the if the person has a bunion or a wider forefoot, how does the shoe fit? Does it is there a seam there that causes a painful point? If they have a bump in the back of their heel, how's the back of the shoe fit? Is it flat or does it have a large bump, again causing a pressure point that's uncomfortable? There can be things that can be laced differently to help the shoe fit more comfortably. And as far as the arch is concerned, that's just a lot of fun, and there's a lot of tricks, orthotics that can be added or taken away to help the person get a good fit. I totally agree with going in when your feet are a little swollen, and even if you're maybe slightly uncomfortable, because if you're going to buy a pair of shoes when your feet are a little sore and they feel great, that's a really good sign that they might be a good fit for you.
Interesting. So even if we get a right size shoe, sometimes depending on our arch, we may want to have a little bit more support or maybe even a little less support. And what type of arch would want like more support?
Sure. Somebody, and this again, a good shoe store is going to help you select these things because if you're not familiar with it, a lot of terminology. People with flatter feet are called pronators. They tend to need a little bit more of stability on their feet, a little bit more of that arch support without pushing up too high. people with higher arches tend to need a little bit more cushion. They will tend to need a higher arch in their shoe without pushing them too far in the wrong direction. They would be considered underpronators. And again, you don't have to remember all these terms, but it's something that a running shoe store or place like that could help you with. Now, once you have your shoes and you have good fits, you can go other places, but a nice running store is definitely an asset to your getting out and going in an appropriate direction.
So it sounds like well worth it, hopefully, to prevent foot and ankle injuries is starting with a good shoe.
Yes.
Okay.
Injuries don't wait for appointments, and neither should you. That's why Fox Valley Orthopedics offers Ortho First, an orthopedic clinic where you can see a specialist the same day you're injured. No referral, no long wait times, at the fraction of the cost. With Ortho First, you get expert orthopedic care right away, plus on-site x-rays, MRIs, casting, and bracing, all designed to get you back to what you love faster. We have 6 convenient locations in Algonquin, Geneva, Elgin, Barrington, and Yorkville, with extended evening and Saturday hours at select locations. Walk in today or visit feortho.com to learn more. You can also call our toll-free number at 855-386-7846. Ortho First, because first steps matter.
What are some of the risks of running in the wrong type of shoes, Angie?
See stress fractures. You can see issues with exacerbation of people's metatarsalgia, which is pain under their foot because they're hitting that forefoot. The wrong shoe can cause some Achilles tendonitis. I think we see that fairly commonly. Or everybody's favorite, plantar fasciitis. So we see that extremely frequently in our clinic, and it's a booger to get rid of after you've had it. So.
Actually, I can attest to that because I bought a pair of running shoes. I loved them. They were wonderful. I started wearing them, and I started getting plantar fasciitis pain. And as soon as I switched back to my old pair of shoes, the plantar fasciitis pain went away. And I tried it again with the same pair of shoes, and it came right back. So they were nice shoes, but I said, nope, they're not the right ones for me.
So that's interesting because even though you probably tried those on and walked around or even ran a little bit with them, felt good, but when you're actually out there training or running, you notice that it caused some injury. And so that's important for people to remember too, I would imagine.
Correct. I mean, the number one rule is if you try on a pair of shoes and they don't feel good in the store, never buy them because you're not going to break them in and make them feel good. But yeah, there are cases where you try them and you start putting on a few miles and you usually know within a week if it's the right one for you or not, and they may be the wrong pair of shoes.
What do you think it was about those shoes in particular that caused your plantar fasciitis?
This one was actually known for having a lot of cushion, and I think it actually had a little too much cushion or give, and so my heel would settle a little bit when I was running, and that was too much stress on the plantar fascia there.
Interesting. So even though there's lots of cushioning, which you'd think would be better for your soft tissues.
It's what I thought. That's why I bought them. Yep.
Interesting. How often should runners replace their shoes?
The stock answer is usually about every 400 to 500 miles for somebody who's doing running on a regular basis. If you're not sure, that's probably 6 to 9 months at the most.
And that's for people who are kind of training more?
Correct. You're getting out several times a week doing some regular running.
Okay. Interesting. So you'd mentioned plantar fasciitis. That sounds like all Greek to me. What is plantar fasciitis, and why are we so worried about it? Obviously I don't know. So what is plantar fasciitis, if you could just describe it a little bit, and why do people hate it so much?
It's an inflammation of the connective tissue that inserts onto the bottom of the heel and kind of helps support your arch, and people hate it because it hurts like crazy. I've had a bout of it. I know Dr. Bartel mentioned he's had a bout of it, and usually the most hallmark signs are people hurt first thing in the morning. I always tell them their feet relax during the night, it tightens up, and then when they get up, it's kind of like a 1-2 punch. The plantar fascia pulls on the bone, you stand on the ground, and now you're in pain. So you get this lovely inflammation that hangs out right on the bottom of your heel, usually towards the inside, but that's varies. And it will get better after a few steps. You do the old lady walk to the bathroom, and then it starts to feel a little bit better. You put some shoes on with a nice arch support, it feels a little bit better, and then it builds up as the day goes on. And then they sit down, they're playing on their phone, they get up to go to the bed at night or go do the dishes, and suddenly it hurts again. So that's the typical patient I see with it. And sadly, the running can cause it to get a little more inflamed. Then they run through it because we start to get that runner's high, and they want to train. They've got that 5K coming up. They've got that marathon coming up. They don't want to cost their training. And so then we're kind of adding insult to injury, and you're adding, fuel to a fire. So we've got to get the inflammation down and get them feeling better.
So for our runners who don't want to stop training, how can we treat this problem and still try to keep running? Or can we?
Well, knowing most runners, I don't say you can't run because it's not going to happen.
Like a non-starter.
Non-starter,
Yeah.
yes.
Understood.
But we say you have to cut back your mileage, and you can cross-train. So things like riding a bike, swimming, doing weights, things that are not high impact, will allow you to keep your conditioning but not aggravate this. Walking is actually an impact activity on your heel. We put 3 times our body weight through our heels when we take a step. Okay, standard. Well, when you run, you put 7 to 8 times your body weight. And just average person, that's exponential. So it's a lot of stress and a lot of force with that running. So in order to allow this tissue to heal for the plantar fascia, we have to back off on that impact, allow your body to heal, but not stop everything completely. So that's where cross-training comes in.
Stretching, keeping your hamstrings supple, keeping your calf supple, rolling out the bottom of the foot, using ice. Anti-inflammatories are an option. People really love cortisone shots in their heel. Said nobody ever, but it can temporarily or be part of a comprehensive program. Usually the shot alone is not going to do it. The other thing is you got to look at what you're doing during the day, what kind of shoes are you wearing during the day, because if you want to run, you got to be nice to your feet during the day. You don't want to be carrying, heavy things on hard surfaces. Give yourself that cushion when you can.
Fascinating. What are some other things that we might see with running, some of the other issues that could come up?
Stress fractures?
We do have stress fractures, and that is a problem for people jumping into the sport, as well as people that have decided they're really going to kick it up. So our bodies like gradual increases in activities. They don't like sudden changes. So if you really get the bug and you say, I am going to go out all out on this and train, you do run the risk of getting a stress fracture, which usually is in the front part of the foot and the metatarsals, but there's different areas where you can get it, and that's a pure overuse type of an injury, where you are stressing your body beyond its ability to repair itself, and it a lot of times will happen within 3 weeks of you starting a new activity or really ramping it up. So if you're getting out there and you're running a mile a day, well, not a mile a day, but you're running a mile a couple times a week kind of a thing, and you suddenly decide you're going to run 4 miles, each time, 5 days a week, that kind of an increase suddenly makes you more prone to a stress fracture. If you gradually build up and you go from your 1 mile a couple times a week to 1.5 to 2 miles a couple times a week for a week or two, and kind of keep building on a gradual basis, you stay away from things like stress fractures.
Yeah, so far for these problems, I hear, gradual workup, good shoes, and give your body a chance to heal, recover. So that's kind of what I'm hearing so far.
Yes. Now, you'll find that, 16-year-olds can go and jump and increase things and go like crazy. Their bodies are a little more pliable and resilient. The rest of us who are
North of 16?
North of 16, we're not quite as pliable, which makes things a little more prone to injury. So we have to be a little bit more cautious.
In researching this, I also found a problem called tarsal tunnel. Now, is that the thing that connects Detroit to Canada, or what is tarsal tunnel?
Why don't you take it?
All right. Detroit to Canada. Let's see. I've actually been over that bridge in my life, and no, that's not what it is. A lot of people know about carpal tunnel syndrome, which is a pinched nerve in the wrist. There's a very similar kind of area on the inside of your ankle where the nerves that go to the bottom of your foot kind of pass through a little tunnel between the bone and the ligament, and potentially this can get inflamed and pinch the nerve, and it tends to cause pain on the bottom of the foot. And it can be a numbness, it can be a burning pain. It tends to bother either the whole bottom of the foot or half of the bottom of the foot, and it's just an irritated nerve. Now, if you leave it alone and just try to work through it, this can become more of a permanent problem if you really get a lot of injury to the nerve. But if you get in and you treat it, you can quiet down the nerve and get rid of that pain.
What would be the treatment?
So, one, we need to take the stress off of that area, which usually involves either a little better arch support to take the pressure off the inside of the ankle and that area, possibly cortisone shots, possibly a little bit of physical therapy just to build up the strength around it and protect it. And lastly, a few people actually need surgery to open up that space and release it if nothing else works.
And these patients are so happy. The tarsal tunnel patients, they know immediately that they're, oh my goodness, I'm so much better, and they're very grateful patients. They are they literally wake up and know that they're better. It's kind of funny, but not every patient needs the surgery, so you've got to be cautious with that.
Yeah, if you've got burning on the bottom of your foot that's been going on despite conservative treatment, once that's gone, it's got to be such a relief, for sure.
Lace up and hit the pavement at this year's Elgin Valley Foxtrot, a local tradition that brings runners, walkers, and the whole community together. Whether you're chasing a new PR or just out for fun, with 5K and 10-mile options, this race is truly for everyone. Don't forget, race day is Sunday, June 1st. And don't wait, registration is now open. You can use code FVO25 at checkout to save 10% on your registration. Let's make this year the biggest Foxtrot yet. We'll see you at the starting line.
Now, you both have mentioned metatarsalgia, which is just a great word, by the way. Can you describe metatarsalgia a little bit? You mentioned as bruising, and just talk about that some.
So metatarsalgia literally is Latin for your forefoot or the metatarsal heads are hurting. So it's an all-encompassing diagnosis. So for us, we see that with our runners because they are pounding on their forefoot, and they will actually get bruising to the foot. They will get a little fluid accumulation under there. They can also get a couple of other conditions in that area, and sometimes that's when it's kind of good to start seeking care and have somebody look at your foot to see, is it metatarsalgia? Is it a neuroma, which is an inflammation of the nerve on the bottom of the foot? And that can lead to some numbness, tingling in the toes. We talked about that with the tarsal tunnel before. Or, are we dealing with a stress fracture? Is there swelling? Is the pain slightly different? Sometimes you'll get an injury to the ligament that connects the toe bone to the metatarsal bone, and these can also happen with overuse, and we call those plantar plate injuries.
So, yeah, and Dr. Google is great for starting to get information, but sometimes as patients come in, they go, well, I looked it up and it could be this, this, or this. I go, yep. So now we have to examine you. We might need to get x-rays. We might even need to get an MRI depending on what we're looking for, just to really rule things out. And The reason is there's a lot of overlap, and there are certain things that we can do in general to treat them that are similar, but sometimes they're different, as in these sprains to the ball of the foot, which is a plantar plate strain. We're actually going to splint or stabilize your toe, whereas if it's a neuroma, it may need orthotics or possibly a cortisone shot. If it's just pure bruising of the bone, orthotics will help offload that area and make you feel better. If it's a stress fracture, we need to immobilize and rest you a little bit more. So, I mean, the treatment can be quite different depending on what these are. Now, in general, to help prevent these or even treat these, good flexibility and strength will be very important for these people. And so how does that come into these things? If you are in general tight, and guys tend to be tighter than ladies, but if you are tight, when you run or walk and you roll through, you're putting a little more force on the ball of the foot. If you're a little more flexible, you roll through easier, it's more fluid, there's less stress to the foot, you have more tendency to avoid this type of metatarsalgia. Also, if you're a little bit stronger, your muscles have a little bit more control as you're rolling through or gliding through, which can also help alleviate stress and overuse injuries on your feet. So as one is getting into a new exercise program such as running, building up on a gradual flexibility program and strengthening program for your legs, aside from just running, is a good idea.
So when you're talking about flexibility and strengthening, is it more specific for the foot? And are there certain things we should be doing for our feet? Or is it kind of, like you said, more of a lower extremity type of a thing we should be looking at?
A little bit of both. Just generalized lower extremity is important. So looking at hamstring flexibility, things along the back of the legs are good. Whether you do this through a stretching program at home, whether you do a yoga class, whether you do, that type of a thing is fine. Calf stretching, things that help you bring your ankle up, your toes closer to your nose, so to speak, are important for this and that roll through, and will also help stretch out the arch of the foot and make things more supple. So those are basic starting points as far as flexibility.
And are these things that we should be doing before we injure ourselves, or is it really only important if we're starting to have problems?
Oh, no, definitely much more important to get it going before you injure yourself, because that'll help prevent the injury. Now, if you do get injured, yes, it's an important part of the rehabilitation, but we want to do this first.
Okay.
It's maintenance after a while, especially those of us who are over 16.
Over 16, exactly.
Over 16.
And so are there different foot mobility exercises that we can do? Is it like twirls, or what do we do for our feet? You mentioned stretching the hamstrings and calves.
I often tell patients to put a towel down on the ground and actually scrunch their toes. And then they can, when that gets easy, they can put like a soup can on there and scrunch that. The other thing, nobody has marbles anymore. So our physical therapist will have them pick up marbles. Well, nobody has marbles, but most people have a towel. And so I have them work on strengthening those little muscles that help pull the toes. The TheraBands, or the stretchy bands, are a really great way to get strength in your feet. You can put them, make a big loop around a heavy piece of furniture, so you can pull your foot out and in with resistance. You can use the same thing for the toes to help get them basically ready to run.
This is another thing where, like the running stores or running clubs come in handy. A lot of them will have like couch to 5K run programs or a walk to run program. And if you can do that, I highly recommend it before you get started with like even your first race, because it gathers a group of people together who have the same experiences, and it will have somebody working with you, and they will go through stretching. They will go through some of the strength work in addition to the actual let's get out and walk to run kind of a program. And so they get you started on that good habit of doing your stretching and strengthening along with your exercise as well.
Almost sounds like having a mentor to kind of help prevent some of these injuries is really important.
Exactly. So, and again, you can find these through running stores. You can find these through local running groups in your area. They're all very accommodating, and they welcome new people, and they're just happy to share their knowledge.
Interesting. So we've talked a lot about all these injuries. When should somebody be coming in to see a specialist?
Swelling is always a good sign that you probably should see some help. Pain when you're walking, inability to kind of stretch and work through the discomfort. So when you're running, if you're having pain with every stride, you probably need to stop what you're doing and see somebody.
Well, as you kind of alluded to earlier, if you're training and you get up the next day, and this is the tough part, but if you get up the next day and you're a little sore, that's not unusual. If you're getting up the second day and you're just as sore, that's probably not a good sign. So, you can come see somebody, or you can take a few days, back off, rest, and if things get better, you're probably fine. But if you're really just not getting any better even after a few more days of rest, so we're talking even like a week type of a thing or less, going in to see somebody is a good idea if you've tried to modify. Now, obviously, if you cannot walk on it, you can't put weight down on it, the pain is that bad, you should go in sooner and see somebody right away. This is more of if you're uncomfortable, you can feel it, you're just not sure whether it's anything bad or not.
Yeah, so those bad sharp pains, that could be like the stress fractures you're talking about, or the bad numbness and tingling, that might be a neuroma or the tarsal tunnel, and those are things that better to get a handle on sooner rather than later. Would you agree?
Correct. I mean, I guess the worst thing that happens is you come in and somebody says, no, this looks like normal muscle pain. Let's do a little more stretching. Let's get a little bit more of that ice and maybe anti-inflammatory things to help you calm that down. But at least you know that it's nothing serious, and that if you do kind of modify and get back in, you'll be able to enjoy your running experience much more than if you ignore it.
Yeah, if there's one thing you hate is to stop training, but you would really hate to stop training for a long time.
Right. Correct. And there's a little bit of peace of mind just knowing, that you're doing the right thing. As you experience more time as a runner, you do get to know your body. You get to know when this is something normal and when this is something bad, and that is very helpful. Granted, I have a lot of friends who are avid runners, and they do tend to have a little bit of denial, and so they will tend to ignore things until it's a little bit worse, and then they find that they're now sitting out of running for a longer period of time than if they'd stopped a little bit sooner.
Angie, are there any myths about foot and ankle injuries that you'd like to debunk or talk about a little bit here today?
I think the myth that I hear most is I thought I walked on it, so it can't be broken, and I didn't tear my Achilles. And sadly, we see both, that people come in walking on broken bones and walking on torn Achilles. So that is the biggest one I see.
Would you agree, Dr. Bartel?
Yeah, unfortunately, I have to agree. So, because in the past, I have personally had an injury. It wasn't running, but I injured myself playing softball, slid into base, jammed my ankle, had some swelling. It wasn't comfortable, but I was able to finish the game, actually scored, kept playing, was a little slower, went home. My wife looked at me and said, "You broke your ankle." I said, "Nah, couldn't
Remind me,
be."
is your wife a physician?
My wife is not a physician.
Just asking.
Okay, yeah. So, and so the next day I got myself into my office and took an x-ray of my ankle and kind of growled a little bit because I had to go home and admit that she was right and I was wrong. I had a little hairline fracture of my ankle, which healed just fine after I put myself in a boot for a while. But if I had not, I potentially could have had more problems with the bones not healing, getting arthritis, and a whole lot of other things. So, yeah, I could walk on it, but it was broken.
So a couple of lessons there, right? Like the importance of early care, listening to your body, and then I guess listening to your spouse. Is that the other important lesson we learned on that one?
It's a very good lesson. Can we play this segment for my husband? Thank you. That'd be great.
Well, this has been really fascinating. I really appreciate you both starting us out with just teaching me so much about foot and ankle injuries, proper shoe wear, and how to pick the proper shoe wear to prevent injuries and with stretching as well. We do have a segment that we have on this podcast called Rapid Fire Questions. And I know you all didn't prepare for this necessarily, but that's what makes it so much fun. So if you don't mind, we're going to start out with a couple of questions, and we'll go back and forth so you both can answer these questions. We'll start with Angie this time, and then it'll be Dr. Bartel's turn to go first next. Angie, if you could ban one type of shoe forever, what would it be?
$3 Old Navy flip-flops.
That was a quick answer. What about Dr. Bartel? What shoe would you ban forever?
Oh, Ranchi, beat me to it.
Not a big fan of flip-flops, I'm hearing.
No, the cheapy ones.
Okay.
They fall out of them.
They've fallen out of them. They've fallen over them. They've broken ankles because of them. Yes.
It could be the same answer if you want.
Yeah. No, it would have to be the same answer. I would have probably said Crocs in the past, but I'm not the hugest fan of them. But honestly, many people like them and do well in them. So who am I to say?
What's the most overrated fashion trend right now, Dr. Bartel?
Fashion trend right now. Ooh, wow. I'm not even sure I know what fashion trends are out there right now.
Crop tops.
Okay, we got Angie's answer to that one. Angie, barefoot running, revolutionary or a recipe for disaster?
Horrible idea. Recipe for disaster.
What do you think, Dr. Bartel?
Not revolutionary. It's been around forever and ever. It's a wonderful thing if you're one of those crazy people. And the only thing is, it takes about 2 years to get into it because you have to get your body to adjust to it. We're also used to wearing shoes that building up the muscles in your feet.
We're not running under.
We're not used to it. So, but if you did this your whole life, perfectly wonderful. For most of us mere mortals, nah, we're sticking with shoes.
Okay. Dr. Bartel, do you play music in the OR? And if so, what are you listening to?
I play music in the OR all the time, and the rule is anything but country.
Angie, would you agree with that, or do you listen to what Dr. Bartel listens to?
I listen to what Dr. Bartel listens to. And I answer anything but country when they ask me, does he like music?
Angie, if you had to compete on a game show, besides this one, which one would you choose?
Wheel of Fortune.
Wow. I guess I'd have to go Jeopardy then.
What is Jeopardy?
Yes. It is Jeopardy. Oh, fail.
And Dr. Bartel, higher arches or flat feet? What's the bigger challenge?
For me, higher arches. They are stiffer, more rigid, less forgiving, and arch supports are not made for them, where like off-the-shelf arch supports are actually made for people with flat feet.
Angie, would you agree, or do you...
Agree.
Okay. All right, and we may know the answer to this question already, but Crocs, fashion forward or a crime against feet?
I'm going to go fashion forward.
If you're talking pure style, crime against feet. Unless you get those little things that you poke into them and, the buttons or whatever.
And that could be very fashionable.
That could be very fashionable.
For sure.
Then. Yeah.
Dr. Bartel, what's the last show you binge watched?
Binge watch? This is due to my wife, and it would be Criminal Minds.
That's an interesting show. Angie?
Reaper.
Nice. Okay, sorry y'all, but last question. If runners take away one thing from this conversation today, what would it be?
Set realistic expectations and be prepared to back off your training if you need to, just to prevent injury, and have a plan for cross-training while you're training.
Have fun and increase things gradually.
Dr. Bartel, Angie, thank you so much for being here to help kick off our very first episode of Ortho Out Loud. And see, more with the puns. I'm telling you, it's not going to stop. You both have provided such great insight into how to keep our feet and ankles ready, strong, and ready to handle the demands of running. Audience, be sure to subscribe so you don't miss our next episode, where a special guest from the Elgin Valley Foxtrot and one of our very own experts from physical therapy will be joining me to discuss proper form, pacing, and finding the right training schedule for you. Thanks for tuning in to the very first episode of Ortho Out Loud. We'll see you next time. This podcast features insights from orthopedic specialists at Fox Valley Orthopedics. While we hope you find these discussions helpful, we are not giving you medical advice or providing opinions about your specific medical conditions or concerns. The views expressed on this podcast are not a substitute for personalized medical advice. If you have questions about a medical condition or treatment, please consult your own trusted healthcare professional. Never ignore professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by the hosts and guests are their own and do not necessarily reflect those of Fox Valley Orthopedics or its affiliated organizations. Any decisions made based on the information provided in this podcast are done so at your own risk, and Fox Valley Orthopedics disclaims and is not responsible for any actions taken as a result of this content. If you are experiencing a medical emergency, please call 911 and seek immediate medical attention.